Kostopoulos, our chairperson, is qualified at Athens Medical University. He's worked in renal unit of Naval Hospital in Athens, in intensive care unit of Hospital of Chest Diseases in Athens, and in respiratory unit of Manchester Royal Infirmary in England. He has been a member of Faculty of Homeopathy in England and of Hellenic Homeopathy Association in Greece. He has practiced in England for 10 years, combining Ayurveda and modern medicine. He is involved in ongoing research in the field of psychosomatic diseases and stress management through Ayurveda. He participates in international conferences and has given lectures in UK, Ireland, Germany, France, Switzerland, Japan and India, promoting modern and scientific view to Ayurveda.
Sarve bhavantu sukhina, sarve santu niramaya, sarve bhadrani pasyantu, ma kaschi dukkha bhavet. Om Shanti, Shanti, Shanti. Thank you for your invitation. I'd really like to talk about a very practical aspect of integrated medicine. I was working in Manchester Royal Infirmary in England, and I was going to start a PhD in asthma. I had met my friend and really teacher in Ayurveda, Ayurveda Barot, many years ago in Greece when he gave a lecture in Ayurveda. And I think this is how my globalization of Ayurveda started. I traveled to London. I'm a medical doctor, so I really wanted to know that Ayurveda is working. I very quietly asked him to allow me to be for a month in his practice, and I was amazed. I've seen that really nearly all his patients were getting better in a mysterious way that I did not know of. And this really prompted me to later ask him if he can teach me Ayurveda. So I decided to leave my PhD in asthma and all the letters and the employments by a pharmaceutical company, and to say, please teach me Ayurveda, and I would like to know more about it. And this is how the integration started in reality in 1989. So when we're talking about integrated medicine and Ayurveda, we have to see what are the needs of the West. Why do we need another medical system that is more holistic than our modern medicine? And I have here the first really slide. We have more side effects. We don't have really treatments for chronic diseases. The cost of new drugs is very high. And really that is why in the West we want a more holistic system. This is the need Ayurveda has to serve, really, if it is to be globalized. And here it is from a work by, Professor Bhushan Patwardhan, comparing Ayurveda and the traditional Chinese medicine. Western scientific community views traditional medicines cautiously and stress the concerns related to research, development and quality. So I know when we are here, we all love Ayurveda, but in the West, there is a doubt. What is Ayurveda? Is there research about it? Is it safe? What is the quality of it? And this is what we have to really face. And again, in the same work of Professor Patwardhan, there is a comparison between the research published in Chinese medicine. PubMed, there are 10,278 papers on Chinese medicine and only 1,045 in Ayurveda. And I'm not going to tell you all these numbers, but just have a brief look at them and see how we need to progress if we want to persuade the scientific world that Ayurveda is worthwhile spreading. Allow me to move to the next slide. The type of research we do with Ayurveda Barot is linking really traditional slokas in Ayurveda and totally modern research in the frontiers of modern medicine. You all know Vasaka, and we know that in Ayurveda, the first quality of the drugs of Ausadam is what we call rasa. And I was always thinking that why did they choose rasa as a first quality? In modern medicine, we are choosing chemical qualities. Is it anti-inflammatory? Is it an antibiotic? Why on there do they choose rasa? And you know, if you put a medication in a capsule and you avoid tasting the herb in the tongue, does it change its ability? And here, Vasaka is a bronchodilator. And see what happened. Now, this has been published in 4th of November 2010, really a few days ago, in Nature Medicine. And you can see here bitter treats for better breathing. And allow me to make it very simple for you. A new study in mice and human tissue shows that in our airways we have bitter taste receptors, something unheard of. Up to now, we thought that taste receptors exist only on the tongue and nowhere else. And these bitter taste receptors, they have an action to relax the airway smooth muscle. Agonists of these receptors seem to be better than current beta-2-adrenergic bronchodilators in a mouse asthma model. It sounds too technical, but it's of amazing significance for Ayurveda. I believe personally that if they found bitter taste receptors in the lungs, probably there are different taste receptors everywhere in the body. And that is why in Ayurveda, I believe they go on about rasa and bitter taste and all these things. And really our intuitive idea, as we borrowed as he guides me, is to open the old slokas, look into these slokas, and then go to totally modern medicine and put these two things together. I'll give you one more example. We always say that asthma is a kapha vikruti disease, but in modern medicine we simply say asthma is a spasm in smooth muscles. Again, this is published in the American Journal of Respiratory and Clinical Care Medicine in September 2010. And they found that there are metabolic abnormalities independent of weight linked to asthma. And they say that if you have a tendency to have insulin resistance, if you have high triglycerides, then you have more tendency to have asthma. Really, they give evidence to what in Ayurveda we say that asthma is a kapha disorder in a kapha organ. And this type of research we needed to really give modern evidence for Ayurveda. And again from Professor Patwardhan, there is need for research. I have highlighted in red here that controlled clinical trials are important to develop evidence for safety and efficacy. This is what the West needs. If you say I'll use anything, they say, is it efficient? Is it safe? Then only we are willing to give time, because you know, time is money, time is everything in the West. You cannot just waste time to study Ayurveda and propagate it. To have a holistic approach of Ayurveda, we have to go again to genomics, compare Prakrit with our genomics, and really start analyzing our herbs in a much more holistic way. Why we give churnas, why don't we have just what we call a single target metabolic drug effect, and we have multi-targeted sites. These are very important issues. And really, finishing my PowerPoint presentation, I want to say that we have a holistic health center in Greece, and we really believe it is a model of this type of integrated medical practice. And I would like to show you a small video.
Oh, Josh, you can come and sit down.
He's one of my patients,
So how is life?
high executive person in Greece.
You live in the States? Tired? Okay, let's have a look at your past. Second?
Well, basically, I'm an executive in a company. The hours are nevertheless very, very stressful. This usually has had in the past a very negative effect on my migraine headache.
So, George, if you compare how things have been in '97, when we first met in October, what percent would you say things are better now?
I would say I had in '97 about an average of 4 to 5 headaches a week. Now, I would say we have, over 90% success. While natural medication, in cooperation with a little bit of yoga exercises and relaxation, really seems to be the answer for me.
This patient who talks about his migraines was coming to see me in London, in our clinic in London. And he would tell me that when he got the migraine, he really wanted to commit suicide, to jump out of the window. He's a member of a very rich family in Greece, and he has been to nearly all the famous neurologists around the world. He's a very good friend nowadays, but when we are talking improving patients through Ayurveda, he improved so much. When this film has taken place, he was willing to come and give an interview against medical confidentiality, to give his name and say how much he was benefiting from Ayurveda. This is the type of improvement we want to see in patients, this type of dramatic improvement.